If you are about to explant or if you have recently explanted, there are some things that you should know about how your breasts might look and feel after your explant surgery. These things that I'm going to go over today can last months. So I think it's just really comforting to know that what I'm about to go over is pretty normal and pretty common. And I do want to go over some things to look out for that aren't normal, to where you should reach out to your explant surgeon and definitely get his or her advice. The first thing is wrinkles. So I had wrinkles after I explanted, and basically what it means is like I had a wrinkle going up my breast. So my breast wasn't smooth, it just had like a wrinkle up it, and it did end up going away probably like 3 months after my explant surgery, and wrinkles are so common. And the gist of this whole video is, even if your breasts have one or all of these things going on right after explant surgery, I just want to let you know that as the weeks go on and as the months go on, your breasts are going to change, they're going to smooth out, and they're going to look a lot better than they do the first week and even the first month after explant surgery. Number 2 are dents. And these are really hard to explain, but I will do my best. So especially since we're wrapped up really tight after surgery, it's almost like there's a dent in your breast tissue. So for me, I was super flat on top, and then there was like a dent, and then I had my breast tissue on the bottom. My dents are kind of still here, and I'm a little over 4 years post-explant, but they're definitely a lot smoother than they were the first few months after my explant surgery. Something else that might happen, and this happened to me as well, are your nipples might be super sensitive to the point to where when you wear a bra, or if you wear a shirt, or if you're in the shower and the shower head water touches your nipples, you might yelp like I did. Your nipples might become overly sensitive, but some women do say that they actually lose sensation in their nipples. So that's something else just to kind of keep an eye on, and to know like it happens to a lot of us after explant surgery, as you might have extreme nipple sensitivity, or the other end of the spectrum where you might not have any nipple sensation at all. Number 4 are having some numb areas. For me, I had some numb areas like underneath my breast here, so like between my nipples and my incision area where a lot of the cutting happened. You might have some numb areas there, maybe like around your armpit. But again, that's just really normal. And, you know, if you do, tickle around and you feel some numb areas, the best advice I have for you is to just kind of stimulate your nerves and just kind of like do this around your breast to stimulate those nerves and help to bring in more sensation to those numb areas. Number 5 are something that I call zaps. So you might have like a little bolt of electricity that just like comes out of nowhere in your breast area. And that's actually a good sign. That means like your nerves are firing back up, and especially if you had any kind of nipple like numbness, like you lost sensation, or if you have any numb areas, if you feel those zaps, that's actually a really good thing. It just means like the nerves are coming back alive. Number 6 is swelling. So again, this is a major surgery, and with any surgery, even if you break a bone or whatever it may be, you're gonna have some swelling from the trauma. Something with swelling is one breast might be more swollen than the other, and that's okay. That's common, that can happen. And especially if you've had a lot more scraping, or if your surgeon had to do a lot more in that particular breast, that breast can be a little bit more swollen than the other breast. So, something to just look out for, and it's very common, is to have swelling for a few weeks after your explant. Number 7 is bruising. And again, this is a major surgery, so little bruises and swelling are to be expected. So don't be surprised if you wake up and you have a lot of bruising. And if anything ever concerns you, definitely run it by your explant surgeon and send him or her pictures and tell him, your concerns, and just get that reassurance back that everything's okay. Or if you need to go back into the office to get something taken care of, you can do that as well. And the last thing, and this is pretty uncommon, but I have heard it happening a few times, is you might have swollen lymph nodes in your armpit area. And again, from just all the trauma and the medication, and especially if you've had autoimmune issues or immune system issues, then your immune system is just suppressed to begin with. Your lymph nodes can get a little swollen. So what you can do is just gently massage in a circular area just to help heal them and get them a little less tender. And with all this being said, just kind of like a sidebar that I want to mention is if you do have drains, it is really normal for one drain to be draining more fluid than the other drain. Each breast is kind of their own thing, their own body part. And yeah, you would expect that you would be healing the same on each side, but sometimes that's just not the case. So one side might look like it's healing a lot better and quicker than the other. But again, just have some patience and trust your body through this whole process. Now, if you have any kind of oozing out of your incisions, if your breasts are extremely painful, if they're red, if anything really, really bothers you, run it by your surgeon. Because while Facebook groups are really, really helpful in these cases of like, hey, has this happened to you? Or hey, does this look normal? We're not medical professionals, we're not doctors, and we're not your explant surgeon. So I'm always like, yes, definitely just have that reassurance and see if anybody else is going through what you might be going through, but also sidebar, have everything else go through your explant surgeon as well, so that he or she can definitely make sure that you're healing properly. And if you're looking for some additional resources and support, I have the 18-step explant checklist, and I also have Discovering Breast Implant Illness, What Now? I will put the links down to both of these resources below. And if you're looking to support Size Happy and show off your Size Happy, there is merchandise available. I personally love these little black bags. They're drawstring bags. They're great for your explant surgery day. I use mine in the gym every single day. And then we also have really cute crop tops. We have really, really comfortable t-shirts. And then we also have these little racer back tank tops that I love wearing to the gym as well. So I hope that this video was helpful, and if you want to see something specific on a future video, or if you have any questions about anything that I've talked about, definitely let me know in the comments below. And if you haven't already, please consider subscribing to the channel, and I'll see you next week. Bye.